Happy to go in order.
That'd be perfect. So your first item would be Senate Bill 586.
Thank you, Mr. Chair and members. This bill, SB 586, responds to the administration's call to create a whole child model for the California Children's Services Program. Under the whole child model, Medi-Cal managed care plans in counties served by county organized health systems would receive all of their services through the plan. Under current law, CCS services are carved out of the plan and reimbursed in what we would call a fee-for-service. The CCS carve-out ends at the end of this year. The administration has stated that they will not continue to extend the carve-out without having children receive their CCS services through an organized delivery system. We've had several meetings with the department and advocates on the bill and hope to come to some resolution, hopefully over the summer. I'm accepting the suggested amendments on comment 7 in the committee analysis, and the sergeants are distributing a mock-up, and I appreciate the staff's involvement in the issue. And with that, members, I do respectfully ask for an aye vote. I have individuals here who would like to speak on behalf of the measure.
Thank you.
Hi, I'm Kelly Hardy with Children Now in support of the bill. You don't want to hear from me about this bill. You want to hear from the experts. And so I have J.C. Aguirre here from Merced, and he's a CCS consumer, and Wendy Longwell, a parent from Reading. And J.C. will go first.
Great. Thank you.
Good afternoon. I just want to say to all you, I'm grateful to have the opportunity to speak here today. It was a very exciting experience. So I'm just going to give a little background on who I am. So I'm 13 years old, and I was born blind and deaf on my left side with malformed vertebrae in my neck. I've had 18 surgeries, and I became a CCS client at birth. My experiences with Medi-Cal make me very concerned about the CCS transition. I've had 7 primary care doctors in 7 years, and that's a kind of a sad figure. Changing providers can be dangerous, and I discovered this a couple of years ago when I fell and had pelvic pain and difficulty urinating. I saw a primary care doctor I didn't know who gave me a urine test and a prescription and sent me home. I ended up in the emergency room because I couldn't walk. If the doctor understood my complex conditions, he would have recognized my symptoms as neurological. Seeing the same providers is essential because my birth defects are not going to go away. The CCS program allows me to be independent and enjoy every moment of my life. With Medi-Cal, to see my specialist, I must see my primary care doctor for referral and wait for authorization. By the time the paperwork is done, I could be paralyzed or dead, and that is extremely scary for someone who lives with that constant fear every day of his life. My CCS caseworker, Anita, knows what I need and makes sure I have access to specialists right away. I don't see how Medi-Cal can maintain the same level of care considering the shortage of in-network specialists. Repeatedly changing specialists will endanger my life. The safeguards in Senate Bill 586 ensure continuity of care for the length of the condition and maintain the high CCS standards. These protections must be included to adequately care for children like me. Without these protections, many children could suffer needlessly. I strongly urge you to pass this bill. Thank you.
Thank you.
Hi, my name's Wendy Longwell. My son Derek has been with CCS his whole life. He has spina bifida, and in April he had his 43rd surgery. And I wanted to, I sit on several committees working on this bill and the different changes that need to be made to it. And I support the bill in a whole, but there's different things that we keep getting told that CCS standards are not going to change. What us as parents are used to dealing with are not going to change. But as I read through this, I'm not seeing the language that guarantees me that. And the main thing, my son had surgery, his 43rd surgery in April, and he just recently turned 21. So I just went through this transition that is going to be happening to everybody else. So this was one transition happening at a time, and it was the most rocky transition I have ever experienced. So what's going to happen when there's hundreds of kids transitioning at once? And the number one thing that I could say is I met with the Medi-Cal managed agency 4 days before my son turned 21, and they still did not have his records from the state, when we've been told they're supposed to get them 30 days before the transition. So if they aren't getting them now, what's going to happen when hundreds are coming all at once? The managed Medi-Cal agencies need these at least 6 months ahead of time so they can review them and be prepared to take on these fragile children. And that is not happening at this time. And caseworkers, they can decide if they're going to keep the CCS caseworkers or not. So when you call your managed Medi-Cal agency, you get a different person each time to talk to about your child's care. And just like what KC was saying with your doctor, same thing. Do you really want to explain 43 surgeries? Do you really want to explain the complex issues to somebody that knows nothing? No, I want a caseworker, which is what I have with CCS, and that's what I want it to continue. And so there's definitely some issues that we need to make sure get resolved so the safety of these children are guaranteed when we do this transition. Thank you.
Great. Thank you very much. Others in support, just your name and organization, please.
Michelle Cabrera with SEIU California in support. We have members here who are both CCS public health nurses as well as IHSS recipients workers whose children are in the CCS program, and we urge your support of this measure.
Thank you.
Okay, I'll speak on behalf of her. This is my daughter, Serenity Chavez. I am Antonia Chavez. I am here on behalf of the SI-15, and I support Truly Really Strong, the 586.
Thank you very much.
Jim Casares, public health nurse in Riverside County, in support.
Thank you.
My name is Danielle Kelly. I'm a public health nurse with CCS in Riverside County, and I am in support.
Great. Thank you.
Mi nombre es María Núñez, vengo del condado de San Bernardino y estoy en apoyo de la propuesta 586. Gracias.
Thank you.
I'm Barbara Anderson, public health nurse, LA County CCS,
Great.
and I'm in support.
Thank you.
Eleanor Volheim, public health nurse, LA County CCS, and also with SCIU.
Great. Thank you.
Cherie Trumbull, I'm with Los Angeles CCS. I'm a member of SEIU 721.
Thank you.
Hi, my name is Vanessa Garcia, Senior Public Health Nurse at CCS, and I'm in support of the State Assembly bill, and I'm also with SEIU.
Great, thank you.
Judy Darnell, in support for the United Ways of California.
Great, thank you.
Kathy Dressler with the Children's Partnership and strong support.
Great, thanks.
Mira Morton here on behalf of the California Children's Hospital Association, also in strong support. Thank you.
Thank you.
Jenna Jensen with Chalk Children's Pediatric Health System in Orange County in strong support. Thanks.
Thank you.
Jerry Jeffy, representing the California Chronic Care Coalition, in support.
Thank you.
Linda Way with Western Center on Law and Poverty in support.
Thank you.
Trent Smith on behalf of the county organized health systems identified in the bill in support of the concept of and look forward to working with the author and the stakeholders on a final product.
Thank you.
Justin Garrett, the March of Dimes, in support.
Thank you.
Terry Calgar Hill on behalf of Children's Hospital Oakland, as well as the Hemophilia Council of California, in strong support.
Thank you.
Margaret Johnson with Disability Rights California. We support if amended and look forward to continued working with the stakeholders to address any amendments that we think are needed. Thank you.
Thank you.
Kristen Hare with the Arthritis Foundation in support.
Thank you.
Sarah Lynn, International Association of Social Workers, California chapter, in support.
Thank you.
Angela Blanchard on behalf of the Children's Specialty Care Coalition, representing nearly 2,000 pediatric subspecialists who take care of these very important kids, in support.
Thank you.
Ilana Ford, parent of child who sees over 15 CCS paneled specialists, in support.
Thank you.
Lori Butterworth, Jacob's Heart Children's Cancer Support Services, in support.
Great, thank you.
Michelle Stoll-Parvinsky, Children's Defense Fund, California, in support.
Thank you.
Hello, I'm Donnell Kenworthy, parent of a child 21 years old who is benefited by CCS. I'm speaking in support of this bill.
Great, thank you.
Bill Remack, California Hepatitis C Task Force, in support.
Okay, thank you.
Jim Gross on behalf of the Cystic Fibrosis Foundation, in support.
Great, thank you.
Lydia Bourne, California Division, American Academy of Pediatrics, in support.
Thank you.
Barbara Glazer with the California Hospital Association, in support.
Thank you.
Rain Hicks, Californians for Disability Rights, in strong support.
Great, thank you very much. Anyone else in support? Seeing no one, anyone in opposition? Please come on up.
Good afternoon, Jennifer Alley with California Association of Health Plans, and we're not opposed to this bill. We just have some concerns, some technical concerns with some of the processes outlined, and we'll continue our conversations with the sponsors. Thank you.
Great, thank you. Anyone else?
Mr. Chair and members, Rick Rollins representing ARC Association of Regional Center Agencies. We as well do not have a position on the bill. We look forward to working with the author about a couple of issues that we have concerning application in the regional center system. Thank you.
Thank you. So anyone else in opposition or in between? Okay. Questions from the dais? Any members have any questions? Comments? So we have some amendments. Are you accepting the amendments?
Yes, I believe I stated that, yes.
I'm sorry, I didn't catch it.
No problem.
Okay.
Yes, willing to take the amendments.
Thank you. Lacking a quorum, I'd like to give you an opportunity to close, if you'd like.
Yeah, thank you, Mr. Chair and members. As you can see, we have a very vulnerable population of children that need services, and I think this young man to my left here so eloquently said that we need to make sure that there's a continuity of care and that this care continues on, whether we do from a fee-for-service or into managed care program. Understanding that, yes, we have expenses that we have to control, but we have to make sure that these patients are taken care of. And with that, when appropriate, I'd appreciate an aye vote.
Great, thank you.
Thank you.
Madam Ms. Olson.
Thank you, Mr. Chair. I just wanted to compliment you in your testimony. You are probably the most poised, confident 13-year-old I have ever seen address the legislature. Well done.
Thank you.
So I guess the question I would have, is he that polite at home? Or I think his mom may differ a little bit. Is that true? But he did a great job. Thanks.
Absolutely. Thank you for being here to testify. Most impressed. If you're at age 13, I shudder to think what you will be like in 10 years. Thank you, Senator Hernandez, for bringing this forward, this critical bill that sets the framework for the future of the CCS program. The bill moves CCS beneficiaries into our counties managed care. I'll note that this includes the entirety of the district I represent. So for this reason, it's important to me personally that the bill passed out of this committee as strong as possible for CCS children and their families by ensuring that CCS beneficiaries continue to have access to high-quality healthcare services, providers, and medical equipment. These are critical services they need not only to stay alive, but to maintain a high quality of life. Thank you for bringing this a strong bill forward as a starting point for negotiations and accepting our amendments. I look forward to continuing to stand with you as we negotiate with DHCS, and with your permission, I'd like to be added as a co-author.
By all means, yes.
Thank you very much.
I appreciate it. It's an honor.
Moving on.